All right. Hello and good afternoon, everyone, and welcome to the December 27th, 2023 edition of our town hall for the Kentucky Electronic Visit Verification Project. We appreciate you guys joining us today for our town hall. I know we're all pretty excited. We are now officially one day out from the go live of EVV here in the state of Kentucky. So again, we're excited to have you guys here for our final preparations and review in anticipation of go live about this time tomorrow. So again, thank you guys for being with us. Hope all of you had a great holiday. I know this week can be one of the more hectic ones of the year. So for those of you that were able to join us today for some last minute preparations, again, we appreciate your time being spent with us. I can tell you that our plan for today is kind of in the same sequence of the town halls that we've been going through before to provide you all with some additional resources in preparation for go live tomorrow and certainly to answer questions. I can also tell you, though, that kind of given the circumstances that we know we're 2 days removed from Christmas and everybody's kind of getting back into the swing of things and in preparation for go live tomorrow, we may have a bit of a shorter call today. Our intention is not to do any brand new content. It's more to provide a forum and review for final preparations for tomorrow's go live and really to give you guys an opportunity to ask questions. So that's our intent for the call today. And we'll get to that content shortly. But before we do, again, just a little bit of housekeeping and a reminder that if you do have any technical issues with your connection to the Zoom webinar, there is a dial-in option. You can see the number and meeting ID on your screen to be able to access that should you need it. And also on the right-hand side, as you can see, reference to a chat icon. The Zoom platform offers a chat icon that you can use to submit any issues that you're having. We've got a group of folks keeping an eye on that for us today. So if you're having any issues and you need to troubleshoot your connection or audio or anything of the like, please send us a chat through that icon and we'll try to help you out and make sure that you can hear us properly. I also want to draw your attention on your Zoom platform to the Q&A screen that you see right here. One of the primary intentions of these town halls is for you guys to have a forum to ask questions. And no doubt you may well have several of them as we're getting ready for go live tomorrow. So we want you to utilize that Q&A icon there on the Zoom platform to enter those in as we're going through the presentation today. We're going to try to answer as many of those as we can right here within the Zoom. Any that for whatever reason we're not able to get to, we do intend to aggregate the answers to those questions and then get them back out to you as soon as we possibly can. So please don't hesitate to utilize that. As we always say, if you're thinking of a question that you have, please don't be bashful because I guarantee there's 10 other people that are thinking the same thing. So please utilize that freely and we will try to get that information to you. In terms of presenters, by way of introduction again, my name is Jason Laws, Therapist Director of Quality and Data Initiatives and one of our leads for the EVV project here in Kentucky. So I'm glad to be with you today to kind of serve as the MC a little bit, but our guest of honor is again Stephanie Masters-Norton. Stephanie is the Assistant Director of Support for our state team. And Stephanie, as any of you guys that were on our call last week knows, has a wealth of knowledge when it comes to EVV, both at a provider level as well as at a state and a state implementation level. And she's going to be reviewing with you kind of a checklist of preparation items for the go live tomorrow. Again, those of you that were with us last week, you saw a lot of this information, but we also understand there always are questions and maybe a few nerves on the eve of going live. So we wanted to have Stephanie back with us today to review that information and also to address any additional questions that you may have. So our plan is, again, kind of our standard opening with some basics of the timelines and general information and an update on where we are in our process. Then we're going to get it over to Stephanie, who is going to, as I said, review preparation for the go live tomorrow, but also give you guys some tips around troubleshooting. You know, when you get up tomorrow and you start trying to check in, if something's not happening quite the way that you're expecting it to, where you can access resources, where you can follow up with us for help, what are the things that you can do in the application to make sure everything is running smoothly. So we look forward to Stephanie sharing that information. And then, as always, we will finish up with a review of frequently asked questions. We had a couple of questions pop up last week that we tried to answer through the Q&A, but for those of you that, again, weren't able to join us, we've tried to consolidate some of that information. We'll review that and also point you in the direction of some past FAQs that we have so that you can get that additional information, and then we will wrap things up. So, the quick project overview and description that everyone knows by now. Therap Services do have the contract to be the selected vendor for electronic visit verification, or EVV, for both home health and personal care services for Kentucky. Just to reiterate again, this is we're coming to the end of phase one of the EVV project here in Kentucky, which again is focused on home health, getting you guys up and running. We will be beginning with personal care services in the new year. In the event that any of you guys out there on the webinar work for organizations that provide personal care services, I know we have heard from a handful of you over the course of the last few weeks, folks that are trying to get ahead of the schedule a little bit, and we certainly appreciate your excitement and preparation for getting things going on the PCS side. But we will begin and we'll be reaching out to you over the course of the next few weeks. So again, just kind of letting you know that for now we are focused on home health with phase one, but we'll be getting to phase two pretty soon. The other part of the contract that we have with the state, on top of the use of Therap's EVV platform, is the provision of an aggregator, whereby providers, whether you're utilizing the Therap EVV platform or a third-party EVV vendor of your choice, either one, you're going to be sending in data to the Therap aggregator, which is going to act as a repository where all of that information comes together and then will ultimately be used to validate and deny claims. So that's the nature of the overall project here in Kentucky. And again, we're going to be focused on home health, which goes live officially tomorrow. As again, all of you guys know, this has kind of been our timeline. We've worked our winding way through all of these steps from the summertime in preparation through all of our town halls that we've been doing over the last several months with getting you all onboarded and providing you with resources and training to get ready for go live tomorrow. And now we are right at the finish line, exactly 1 day away from going live. And so we appreciate all the work that all of you guys have done over the course of this process, and working with our trainers and being there and being prepared for tomorrow's go live. Again, the two options that all of you have, of which I think we have many, I would say it's a roughly even split in the state, in our experience thus far, is folks that are either using option one, which is using Therap as the state system, or option two, utilizing a third-party system. Again, as part of the state contract, option one is provided to all of you at no charge. You have an EVV platform that is available to you. It's what we've been working with most or many of you with over the course of the last few months to get set up and get prepared for the collection of EVV data. It also has, as part of it, a full-scale billing and claiming system that is your option to use. Again, that is an option. If you have a billing platform you already utilize, you're more than welcome to continue to do so. But if you choose to utilize Therap's billing platform, that is available to you at no charge as well. And we're certainly here to support you in the use of that. I know several of you have gone through some training on billing on top of the EVV setup that you've done. The other option, again, is the utilization of a third-party system. For those of you that may have already been collecting EVV through another vendor, or you just have a preferred vendor that you're working with, you're certainly welcome to continue to collect that EVV data through that third-party vendor. With the caveat, obviously, that those guys have to go through a certification process with us, of which we've had several vendors going through that process. Again, they are right at the line of getting connected so that the data that you're collecting through their platform will flow over into the aggregator, just as the data from the Therap EVV system will use. So all of you guys have had these two options available to you. Certainly, it is our hope and expectation that by now we have spoken to each and every one of you home health providers out there and got you guys onboarded and prepared for what is to come over the course of the next couple of days. But if God willing, we have not yet received an invitation to any of you guys or you have not yet received an invitation from us, or we've not spoken with you to initiate your onboarding activities, please reach out to us as quickly as you possibly can, either through our support alias at KY Support, therapservices.net, or you're certainly welcome to utilize the state alias that you see here as well, the Medicaid public comment at ky.gov. Either of these options will get you in touch with us, and we will get to you and expedite onboarding you as quickly as we possibly can. When you do make that submission, we do ask that you enter both your name, your contact information, the name of your provider organization, as well as your provider number. That will make it that much easier for us to get things rolling and get you on board. So, as I said today, what our focus is going to be, again, is that preparation and troubleshooting for go live. But I wanted to do a very, very, very quick review of a couple of resources that we talked about last week. You know, last week we talked about go live, but prior to that, we also focused on some of the foundational elements of EVV. And that is the scheduling of slots within the system and the checking in and the checking out. That's really what it all boils down to, as your caregivers providing support to individuals and being able to check in and capture those required elements of data relative to EVV. And so what we've done here is just for an ease of reference, you know, we've given you guys all, I think, access to a ton of resources, but just for ease of access, I've also embedded within here, within the graphics that you see, some quick resources that I think could be useful for scheduling. If you click on that picture, when you guys get a hold of these slides, you will go straight to our user guide for the creation of scheduled slots within the system. And then we also have what we refer to as our checking in and out module simulators. These are great tools for caregivers that are learning how to use EVV. And for the two different options that we have, for those folks that are checking in and checking out of pre-scheduled slots, we have a simulator here that will allow you to do that for both Android and Apple. You can click on any one of these and it will walk you through the steps associated with checking in. So that can be a great tool. If you are working on self-check-in, meaning you're not working off of a pre-scheduled slot, you're just checking in directly without a slot to work with an individual, we also have a simulator for that for both Android and Apple devices that will walk you through the steps associated with that. So I wanted to embed those tools in here just so that you have access to them. Again, as soon as we finish up our town hall this afternoon, I'm going to get these over to our team and get these slides posted on our site. I'm going to provide you with the URL for that site here a little bit later on in the call, but you'll have access to these and access to the associated resources. So we hope you will check those out. So with that said, and that out of the way, I'm sorry, before I give it over to Stephanie, I did want to bring up this slide as well, which is the full listing of all of the billing service codes with whom we are currently working for our home health. If you provide any of the services that you see on your screen, you are the ones that are involved with phase 1 of the EVV project. Also, some of you, as I mentioned a bit earlier, have been a little bit ahead of the game. You may provide PCS services through some of your waiver services, and you may not see the services that you provide on this screen. Therefore, what that means is you will be part of phase 2. And again, we'll be reaching out to you guys in the very near future to initiate things. But for those of you that see your services on the screen here, you guys are the folks involved with phase 1 and the ones that we are working on now. And now, again, with that, it is my pleasure to turn you guys over to our resident expert, Ms. Stephanie Norton, who is going to go over some of the last-minute preparations and troubleshooting activities that you guys can do in preparation for tomorrow. Steph?
Thanks, Jason, and thanks everyone for joining today. If you were here last week, this may be a little bit of a repeat, but would love to answer any questions that you have. So feel free to put those in the Q&A so we can monitor those and respond. So what we're here to talk about is what you're going to do tomorrow. When things go right, what it looks like, and when things go wrong, what it looks like. So I'm going to go through the most common scenarios of things that you may run into tomorrow. And hopefully this will make you feel a little better prepared for what's coming your way. So the first thing that you may encounter, you know, you've given staff their login information. Maybe some people are already logging in. Maybe you're giving it to them today or tomorrow. If they cannot successfully log in, they will see a screen similar to this. If they're logging in on the web browser, if they're logging on the mobile app, they'll see a similar login failed screen. So they have multiple chances before their system locks them out. You know, they have multiple tries, but there is a point where they're out of tries. You may have to reset that password for them, or they may call you frantic saying, I can't get in. So I'm going to walk you through how you can do that from the web browser and from the mobile app. But one important thing, and I'll stress this a few times on the call, is their app should not prevent you from delivering services. So tomorrow morning, the nurse arrives, the OT arrives to provide a service. They can't check in. They should still deliver that service and document it in an alternate method. We'll show you how you can go in and manually enter that data on their behalf. Ultimately, your life will be made much easier if your staff do check in and out. So you want to encourage that, but we don't want this to be a barrier for anyone to get services. So let's talk about how to resolve the password login failure on your web browser. So if you're working at your computer and you get a call, you can go to your admin tab and you're looking for that change password user list. You'll see all of the staff in that list, and you can actually search by a name if you have a lot of staff. You'll click on that login name for the user and it'll take you to a screen that looks like this. So you're going to create a temporary password for them. So you don't have to ask them, what do you want your password to be? You're just going to create a generic password for them. They're going to use that to log in, and it will prompt them to create their own password at that time. One other reason, or a couple of other reasons that people might get a login failure, they may not be putting in their correct login name. So you may want to confirm with them when you say, hey, here's your temporary password. Remember, your login name is Jay Sanders. You know, maybe they're putting in their whole first name or whatever the login name is, just confirming with them. There is also that provider code. So when you go to log into their app, whether you're doing it from the mobile app or the web, you'll have to put in that password, and they'll have to put in their provider code. So that does have to be in all capitals, and it always will end with that -KY for Kentucky. So confirm again, hey, this is your login name. Here's that temporary password for you. And remember to put in that provider code. If they miss any of those pieces of information, that will cause the login failure. So I'm going to get logged in and want to point out something else that your staff will see when they've logged in. This is a sign-up agreement. This is in everyone's account, and it's language from the state, just about security, confidential information. This is going to show up at every single login, and you will need to click agree. If you click disagree, it just logs you out, and you got to log in eventually. So go ahead and click agree and say yes. If you're an admin user or super admin, you may be seeing this screen, and it tells you up here, if you want the screen to go away, add in this information, your address, phone number, and email address. If you're not ready to do that right now, you can just scroll down and click cancel. Something else that you may not have seen before, this is called a splash message. We put these in the system to notify users of an upcoming release. So this is telling you that this evening, we will have a release, and it will go through until early Thursday morning. Hopefully this won't interfere with any of your services, but just know we will have downtime and early in the morning tomorrow. And we give links to those things, the release notes, so you can see what the changes are. So you may see this when you log in today. This will eventually go away. It's just kind of a reminder to get your attention. And this will show up for your users until this is taken away. So I think this goes down tomorrow. So I'm just going to click my dashboard here to get past that. Because that release is happening, it will require a mobile app update. So if your staff have already downloaded the mobile app, when they go to log in tomorrow, they're probably going to get a notification that says you need to update the app. So it'll prompt them to do that before they can log in. So I'm just going to go show you that change password here, user list. I can find that user, and you can use these search boxes up here if you need to. That'll just narrow down your results for you. And you're going to click on the login name in blue to be able to get to that change password screen. You can also do this from the mobile application. So if you're out and about, you're not at your desk, you want to be able to reset a password really quickly. When you log in from the mobile app on your smart device, you'll see this password reset button. And it's the similar setup. You'll choose the staff and then give them a new password here. So one thing I want to point out back in your account, this is something you may want to give to supervisors, managers, people that are going to be able to respond to staff quickly, to be able to give those users the ability to reset. What you don't want is this to rest on just one single person. You need to have some backup options. So if you want to make sure that you have people assigned with that password reset, that's going to be in your user privileges, which is on your admin tab. And we're just going to click manage here. I clicked the wrong thing. Here we go. So I would go in and find that user. You may remember this screen from setup. This is showing what access they have with individuals, but down here are some optional fields. You would want to make sure, if this is a staff that needs to be able to reset passwords for service providers, you would want to give them that reset password button. Now, this will give them access to all the staff in your account. So keep that in mind. You don't want to just give this to everybody, but it's good to have more than one person who can do that reset. If you as an admin cannot get into your account, you're getting that login failure. Anybody else that has that super admin check mark and that reset password can reset you. So that's probably a smaller group of people, but just keep that in mind. Okay. Best case scenario, and something to plan for in the future, if you haven't started doing this yet, you can go in and give users the ability to manage their own password reset. So that means they're in the field, they can't remember their password. If they have done the steps to configure this process, which I'm going to show you, they can actually request a new password from our system. So it does require some planning in advance, so it may not be something you're ready to use tomorrow. And we have a user guide here that has a video as well, so that'll be linked in the slides for you. But I'm just going to go show you from here on your admin tab under user. You would see that self password reset. It's going to show you all your staff. And let me zoom out here. Over here, it's giving you the option to enable, or if it's already enabled, you'll see the option to disable. So you don't have to do this for everyone. If you want a user to have this access, you would just click that enable button. That gives them the access to do it from their end. So they still have to do something, but you have to give that access from here if you want them to have that function. So what the users will have to do, and we've again got those resources built into the slide deck for you and on our support page, from their settings tab from the web browser, they would see a self password reset configure option. So if you've enabled it for them, this will appear in their settings. They would come in and put the email address is what we recommend, where they would want to receive a new password. So a token or a temporary password from us. So they'll go through that process of verifying that address. They do have the option to use a text message or an SMS address. It's just a little more complex. You want to make sure you refer to this user guide because it's not just your phone number. It's your phone number at your cell phone provider. So once they have done that, they will see an option on their screen that says forgot password. So if they're trying to log in, let me go show you that really quickly here. If they get that login failure screen, they can actually click forgot password and it's going to ask them to put in what they've configured in their account, their login name, their provider code, and either that email address or that SMS address that they've already configured. So if they haven't configured, this isn't going to work. But what this will do is send them a message to either of those addresses, and it will have a temporary password in it. It will be all numbers, and it'll tell them this number will be valid for 5 minutes. So they can use that to then log in and change their password. Okay, so password will probably be one of the first things you run into, maybe not. Hopefully not, but there are many options that you have to manage that. Another common issue, and I'm just keeping an eye on the chat. So Jason, if there's anything we need to talk about, just jump in and let me know.
There was a quick question about what to do if you've forgotten your password on the mobile app. I don't know if you want to.
Yes, so I don't know for sure if the forgot password option appears on the mobile app. You can always log in from your mobile app through the internet browser to be able to get back to that other screen and be able to do forgot password from there.
Yeah, the web login link at the bottom of the right.
Yep. So another common issue that you may run into is if a staff they've logged in, but they're going to do a self check-in and there's not a service showing up. You may also run into this if you're scheduling something in advance. You go to select the service from that dropdown and nothing appears. There could be a variety of reasons that happens. So I'm going to talk to you about the things that you can do to troubleshoot and figure out that issue. You can always get in touch with us and we'll remind you of the ways to contact us. But this is just showing what you can do in your own account to try to troubleshoot the issue. The first thing that you would want to do is to check the service authorization status. So I'm going to go back into that demo account and just show you what that would look like. You would go to your billing tab. And most of you are using the institutional claim. So we would go to that service auth search. And you can type in the individual's name. If you want to just see everything, you can scroll down and search. But you want to check the begin date and end date. First, is there one there? Is there an authorization there? If not, then you need one. If it's there, but it's not showing up to select, what are the dates that are listed there? I know some of the authorizations have a short time period, and you may be even a little bit delayed in getting that new authorization. In TheraP, you can create the authorization and put the dates in there so that you can continue to collect the data. And if the dates are not valid, the service doesn't appear. Another thing to check is the status. The status of the service auth needs to be approved in order for it to show up. And the expiry status, these should say active. So if you have anything that is expired, that is your issue, right? You've got to have an active authorization in there for that individual for that service. When you open these up, you do still have the ability to edit here. So if this is something that had expired and you need to extend that out, you can update that date. So service authorization is typically the first place that I would check because it's, if it's not there, then that's your reason. But if your authorization is there, your dates are good, it's approved, it's not expired, we would want to check your EVV configuration. So this is something that we did with you in those setup calls, but maybe you've gotten a new staff member and this is a step you forgot, or this staff person doesn't have all the services assigned. On your admin tab, under that scheduling section, you would want to go to staff manage. And I'll just go show you that since we've got some time together. Down here, I'm going to click on staff manage. Again, it's going to show me all my staff. I can use the search box here to find the person that I'm looking for. And then I would just click to open that user. So we want to make sure that they are schedulable. That means they're showing up for the scheduling EVV module. And we need to have self check-in enabled. That means they can do that check-in without having a schedule created by you. The other thing you want to confirm is the service description code. So remember, in your account, we actually have services listed multiple times because they're listed by payer. So it would be in your best interest to just choose all. If this is a physical therapist, choose all those physical therapy codes that are there. If this is a nurse, choose all those nursing codes. They will only be able to check in on it if there's an auth. So this way you can just ensure if you ever get an auth with that payer, you've already got your staff set up correctly. So in that drop down, you can change or select additional services. And this is how it will appear for you. So you can see the services that you've selected have a check mark beside them. So if there's one there that is not checked, that needs to be, you want to go in and select that. And then click that save. So perhaps that was the issue. If that is still not resolving the issue, the other thing I would say to check is under scheduling provider manage. This is sort of where you're managing for the whole account, which services are available for self check-in. So again, you can just check and see if we didn't have that selected here, we could add it and then save. So those are the places that I would recommend troubleshooting if you're not seeing a service show up when the staff are going to check in. So the staff's checked in, they logged in, they checked in, but they get to that location piece of their check-in and they're telling you that the information is incorrect. Maybe it has them at the house across the street or the house down the street. One thing for you to consider is that GPS location is not always 100% accurate, and it's really looking more at proximity to that location, where their residential address is for the person, rather than a precise location matching that address exactly. So what you can do is have your staff use that comment box. There's always a comment option there for check-in and check-out. So if they're getting something that says unnamed road, or maybe it is showing them at a different house than the one that they're at, they can make a note there in the comment just so that there's a record of that being recorded. You may also have staff tell you that they're trying to check out, but they're getting this message saying that they've moved, they've got to go back to their location. And sometimes these messages can be confusing to understand what they mean. In this situation, you've moved away from your checkout location. This means the staff has gotten to this screen, they've started their checkout, but they haven't finished it. They haven't touched that check mark or that submit button to get that data into the system. So if they've initiated this, but have moved location, maybe they started backing out of the driveway and driving down the street, but they haven't clicked that button yet, it's actually following their location and saying your physical location has changed from when you started this checkout. So you either need to go back to that point, or they can just start the checkout again to capture that updated location. I know this is a lot of information. We have all of this available for you in other resources as well. But just know that we're here to support you if these situations become barriers to you using the system. Again, worth repeating, if you cannot collect the data, the staff can't log in, the service isn't there, for whatever reason, they can't check in, they need to continue to provide the service, and you can have them document on paper, or maybe you have another system that you're using for payroll or some purposes. This needs to be captured, the check-in, check-out, where they were, all of that information needs to be captured. And then you as a scheduler or an admin can manually enter that data in our system or update data that needs corrections. So that's what I'm going to show you now. We're going to cover this a lot more post go live. Once you have real data in the system, we'll start looking more at reports and how you can review your information in the account and make changes. But for tomorrow, if you want to see what's going on in your account, or you need something there's something you need to correct in your account, you can go to your agency tab and you'll find the scheduling section there. If for some reason you don't have an agency tab, you can also find it on your individual tab. We're going to go to create edit. So this is where I can choose who I want to work with on my schedule. If you have multiple locations, you may have multiple programs. So you're choosing which program you want to work in and click next. That's going to give you the list of individuals or people receiving services. So you can choose who you want to work on there. And then next takes us to staff. And I would just recommend skipping staff so that it gives you access to everyone. So we have made our selections. We've pulled up our scheduling grid. I can see those individuals here on the left, and it's always bringing us to the current date. This date view is starting at midnight and going until 11:59 p.m. today. You can also look at this in different views, and I like to look at the month view. So this lets me see a little bit more what's going on, what are the different statuses that my visits are in, and you can refer to that up here at the top left. So best case scenario, everything's green. That's wonderful. That means that you have a completed visit, check in and check out. You can still open those visits or hover over those visits to see a little bit more information if you want to see the exact details of where they were when they checked in and out. The things that are orange means someone has started that visit, they have checked in, but they have not checked out. So on the 28th, if you come in and your visits are orange, that's good. That means people checked in. At the end of the day, you would want to see those visits be green. If you have data like I do from last week, that's still that orange color. At that point, it's going to require me as a scheduler or an admin to come in and correct that data, because the staff can no longer go back in and enter something. They can only do it within that same day. So I've double clicked to open that visit, and I'm scrolling down here. I can see the check-in time, the location, and the checkout data is missing. So I would use this action edit button to come in and enter that missed checkout. So you refer back to your documentation to find out what they actually checked out for, and you want to make sure you choose that date. And I'm going to use the clock here to select the time. I highly recommend that you use these built-in options, because the formatting has to be specific, and it can kind of be frustrating if you are typing it in and getting it messed up. So we're going to come in here and click on the hour, and we can choose any hour. And then if we click on the minutes, we can choose 5-minute increments, and then AM and PM toggle. We do have to say where we were. If you do not see the address you need in the drop down, or this is no longer their correct address, you can go in and update this on their demographic form. You can always type in that address here as well. And then because we're touching this data, we're changing it or we're entering it manually, we have to put in this exception code. So this is an explanation or the reason why this data required an edit. So you're going to use your best judgment to choose from the options that are here. This is telling the state why this was not collected in real time. So maybe it was that they forgot to check in and out. And then you can use this description box to even make a note that you verified times with daily note, or whatever that language is for you, just for your own purposes, that you can confirm, yes, this did match what was in our other system or on documentation. So we got a banner up there saying it was updated, and now I can see that data is present. I'm just going to close out of this, and the visit that I was working on is now highlighted in this little light yellow color, showing that that's the one I was working on. But if I just click off of it, I can see that visit now shows as green, which is that approved. It means we have it completed, check in and check out. I talked to you about those comments earlier, how your staff can leave comments on the visits. There's an example here that I want to show you where if I double click to open this visit was supposed to happen on December 18th, and there was no check-in and check-out, but staff left a comment here. So even if they weren't able to complete the full visit, they can use that comment box to leave you a message there that says that the phone wasn't charged. They checked in at 9:03 and checked out at 12:05. So they've given me the information that I need, and I can verify that with my documentation. From here, I could do that same thing, action edit, select my day, use that clock to select my time. And then I can actually use my arrows to get to 9:03, put in that location, and then same thing with the checkout. The bad news is for me, I don't remember what they said our checkout time was, 12:05. So remembering that you have the data to be able to enter on that screen, you can manage that information from this screen. All right, so if you have staff that need to use the offline options, maybe they don't have cell service, they don't have internet connection when they're going to deliver that service, you would need to schedule something for them in advance. And you can do it from the screen just by going to that day, finding that individual and the time that they need to start. We're saying this is for that program, choosing the service, and then assigning it to a staff person. So this is the option that you have to put in a schedule in advance so that someone can use the offline app or even call in on a telephone if they needed to. So I would approve that. And now I can see that visit's there. I'm going to talk to you in a few minutes about how your staff would use that information or access that information to do the other offline or IVR check-in and out. One other way that you can create visits really quickly, let's say you just found out this person's not going to have service and you need to put a visit in so that they can check in. From that individual or agency tab under the scheduling section, there is a new slot button. So this is like a one-off visit. Instead of loading that full calendar, I can come in and find that person and create that visit for them here. Same thing, we want to just say the date and time that it starts and ends, the program, the service, the staff. These other pieces here are optional, so you do not have to fill those sections out. This top bit is the required part. And then you would want to make sure you approve that when you're done so that it's available for your staff to access. All right, back to my slides to see what else we need to talk about. Perfect. The options for when you don't have cell service or internet connection. So as I mentioned, you have two options here. Your offline mobile app, which I would recommend if the user has access to a smartphone or a tablet, they can use that offline app. That's probably going to be the easiest of these two options. But there is an option called interactive voice response, which is basically a telephone call. It would be a good solution for someone who doesn't have that access to technology and they also don't have internet or cell service. But both of these require the scheduling in advance that I just showed you. If it's something that you do need to utilize at your agency and you have set schedules that reoccur, we can show you how to do a bulk copy. And that's something we're happy to work with you on or share resources for you. So the offline app, which is my favorite way to collect data without cell service or internet connection. This is the view of the mobile application. So this is accessible from the mobile app. Your staff would log in and go to their settings tab. This is a one-time setup. They have to create their own password for the offline app. So they would choose under settings, select that offline EVV, and then it's going to ask them to put in a PIN. So this is effectively their password for offline, and it needs to be at least 6 numbers. It is looking for numerical data here. So the good thing is if they forget what this PIN is, as long as they can get into their mobile app, into their TheraP account, they can come in and reset it. Once they have set the PIN, they would see this switch to offline login option. So if someone tells you, hey, I don't see that option on my login page, it's because they haven't done this piece yet. So it's not going to let them log in if they haven't created a PIN yet. So this is what that looks like from the offline app. Your staff, once they log into offline, this is where you would be looking to find the visit that they've already added. So you've scheduled it. They could come in and add it to offline from the regular application. And then when they log into offline, this is how that visit will appear. So there's no protected health information associated. It's not going to have the individual's name there. It's going to just refer to the visit as a slot ID and the date and time. If they did not add that visit in advance when they're still on service, maybe before they leave the office or leave their own house, they go in and add these visits to offline. If they haven't done that, there is still an option on the offline app to select add new slot, but it will require them having the printed schedule, which I'll show you in just a minute, because these slot IDs are on the schedule and they could enter that to be able to check in. So they've collected data offline, it's stored on their device. When they get back to a place with service, even if that is a fast food restaurant or a library, they would log back into their regular app and they're going to get a notification saying, hey, you've got some visits that were in offline. Giving them an option to upload. We do recommend that they upload as soon as they can, because that data is not in our system until they do this step. So if they've collected the data and then they drop their phone in the toilet or they lose their phone, that data is not in our system. So it would have to be manually entered by you. They will also get a notification that it can take up to 30 minutes for you as a scheduler to see this data. So once they start the upload, it's not there immediately. It will show up about 30 minutes after they've done this upload. Okay, if there's no cell service or internet and there's no smartphone or tablet available, this is the last option that we have for you, which is IVR, or interactive voice response. And this is just showing you the workflow. It is literally picking up that phone, making a phone call, entering some information that has been set up in advance, and then doing that same thing for checkout. So in order for your staff to be able to use that option, they do have to log into the web browser and set up this IVR settings under their settings tab. It will show them there what their IVR user ID is. That's going to be automatically generated by our system, and that number does not change. But they're going to create a PIN similar to the offline. This is their password for that IVR system, and it's looking for this to be 6 digits. If they forget this, it's not going to let them log in, so they can do this reset here. Also, if their password expires into their regular TheraP account, they will not be able to use the IVR. It'll tell them unable to authenticate. It's because their password is expired, so you would have to reset that for them. So IVR is a little complicated because it requires you to do something and the staff to do something before they can make the call. This is where you would get the information about the schedule itself, those numbers that would be entered either on offline or if you're using IVR. So on your dashboard on your web browser, you have an option over on the right where you can print your own schedule. If the staff is not able to print their own, you can go on into the individual tab and you have an option to print a schedule on behalf of a staff person. So you can type in the staff that you want to print for, the date range, and it will generate this PDF. So you can email them this PDF, print this PDF out to them, whatever, or they can generate it themselves. This is a close-up of the details of that schedule. So it would show you who the schedule's for, which staff person, the date ranges, and it would show their IVR user ID. So if they don't see that, it's because they haven't configured their PIN yet. So it's not going to show them that ID if they haven't set up a PIN, because they couldn't log in anyway. This schedule will also show the phone number that you could call to begin the check-in and check-out. And then it's going to display the dates that were selected for that schedule, the times, the service, and then again, it shows that staff person that's assigned. These numbers that are highlighted, those are the slot IDs. So either the offline app, you could manually enter it if you haven't added it in advance, or if you're making the phone call, this is the information it's going to ask for. So this is that workflow. They would call that number. It's going to ask them English or Spanish. They're going to enter their IVR user ID. It's going to ask them for that 6-digit password that they've configured. Then it will ask them for that slot ID. And then they would press 1 to confirm that check-in, do the same thing at checkout. So this option works. It just requires a little more prep to be able to make it successful. Okay, before we go into that, one other thing I wanted to talk to you about, and I think I actually had a slide of it here. When you're using the mobile app to check in and out, which most of your staff are going to be doing, sometimes that keyboard is frustrating to type on. Maybe you have a really small device. There is an option to enable biometric authentication, which would allow you to, if your device supports it, you could sign into the TheraP mobile application either with a fingerprint or a Face ID. So that's optional. It does require you to give that option to your account. So you would turn it on for your entire account, and then each staff can decide if they want to use it. So I just want to show you where you can do that. It's on your admin tab under these provider preferences. This would be a one-time setup for you. If you want to give staff that option, it's down here at the very bottom. We want to enable biometric login and then just click update. It will require the staff to configure it from their side. And if their device doesn't collect that kind of data, they won't be able to use it. But it can make signing in for the app and the check-in and check-out a lot faster, especially if they're doing a lot of visits in the field. Okay, were there any questions that we should address? Not seeing any, but happy to answer any if there are any that come through. It looks like the ones that have come in Q&A have already gotten a response.
Yeah, don't think we have any others right now.
Cool. Okay, I'm going to show you how you can get in touch with us. We've given you a lot of information. We have a lot of information available for you on our support page. This has been curated for what you're doing. So we have a training course on some of those setup tasks. If you need to repeat some setup, maybe for a new staff or do some troubleshooting, a short on how to reset passwords, how to enable that self-password reset. You could send this to your staff if you're enabling it for them. This also shows them what they need to do in their account. So you could send that to them. A quick video on how to enter that missing check-in and check-out data that I reviewed with you. And then the simulator, this is a great training tool for your staff. If they're not sure how to check in and check out, send them this, and then they can choose which platform they're using and go through the steps, just so they can kind of see a tutorial of what's going to be required of them before they do it for the first time. And I'm just clicking these to go through. There's that location piece. I can leave a comment, and then I've checked in. So it should be really straightforward and easy for the end user, but we recognize it is a lot more work for you maintaining the account and doing that setup piece. So check out our support page. I'm going to put that link in the chat. And then you've also got access to the support email address, which is kysupport@therapservices.net. We are going to be monitoring this and we'll be responding to any requests for assistance there, whether it is just responding with how to resolve the issue or offering a meeting to help resolve. That is the fastest way to get support from our team. And Jason, if there's nothing else from me, I'm going to hand it over to you and let you talk about the other support alias.
Great. Thank you, Stephanie. Let me get my screen back up. Share and slideshow. So much appreciated, Stephanie, and thank you for all of you guys that have been asking questions throughout the presentation, through the chat and the Q&A. We appreciate it, and certainly feel free to keep them coming through the remainder of the presentation. But to continue to build off of what Stephanie was talking about, again, it's our goal to support you guys as much as we absolutely can, and utilizing the KY support alias at therapservices.net is going to be the best way to do that. Certainly want you to access the EVV support page that we have, as well as the 1915C waiver help desk. This is a resource provided by the state as well. All three of these are going to be great resources for you guys to get the information that you need. Now, on top of all of that, we know there's already been a lot of questions that have come in, certainly over the course of the webinar today, as well as in past webinars and town halls that we have done. We've tried to answer as many of those as we can today, but please continue to ask as we finish up. I did want to quickly address a couple of questions that I know came in last week, one of which I know Stephanie has already addressed through her presentation, but just want to make it abundantly clear for folks that continue to have any questions around the enabling of offline check-ins on your mobile app. Some of you may have gone in to log in through the mobile app and noticed that that's not automatically there. That option you saw on Stephanie's screen for offline check-in isn't automatically present through the app. You do need to log in at least one time and then go in and configure your offline PIN, which again, I have embedded here within the slides, the instructions for doing that. You can go in once you've logged into the mobile app, you can go to the settings, configure your offline EVV PIN. And once that has been configured, you will see the switch to offline login will be an option at the top of your screen. So I know we'd had some questions on that, so wanted to make sure folks knew how to do that. The other question is really a repeating question that we've gotten several times over the course of our town halls, but again, I want to make sure we're addressing it on a routine basis because I know it's something at the forefront of a lot of you guys' minds. Is the go live date tomorrow on 12/28 a quote unquote soft or hard launch date, effectively meaning is this going to be the date where immediately these EVV visits are going to be used to validate or potentially to deny claims? And so the answer to the question is this. It is the expectation, certainly from TheraP and our support of you, but much more importantly, from the state of Kentucky, that all providers out there will be expected to begin collecting EVV data no later than January the 1st, 2024, which is next Monday. That is the expectation of the state as to when you're collecting EVV data, whether it be through TheraP's EVV platform or through your third-party vendor. Having said that, we will not immediately be utilizing the data from those EVV visits to validate and deny claims. So it is in effect what you would call a soft launch date, meaning the expectation's there for you to collect the data, but it's not going to be used to validate and deny claims immediately. Again, we ask that you guys follow up directly with the state going forward. I can tell you that the expectation is that data will be used to validate and deny those claims in the reasonably near future, but the communication specifically about the timeline for that is going to come directly from the state of Kentucky. So if you've not seen that yet, I expect that you will soon, and certainly feel free to follow up with DMS with further questions at the email address, the alias that you see on your screen, the Medicaid public comment at ky.gov. Please feel free to share additional questions there. And again, on top of that, we've had a lot of questions over the course of all of our town halls over the last several months or weeks and months that have been archived on our EVV support page that you saw Stephanie bring up just a moment ago. If you scroll down to the bottom, you'll see where those are as well. So we certainly encourage you to go check that out for additional information, as well as all of the other training resources that can be easily identified and clicked on there. It's a really great resource, whether you're the administrator for your organization, whether you're the person going in and creating schedules, or if you're a caregiver providing services and you need some reminders on checking in and checking out. All of those resources are readily available. We have recordings of all of the town halls that we've done there, as well as the associated slides. Again, we're going to get the slides from today posted up hopefully within the next 24 hours. That's our goal, is to get them up as quickly as we can, and we'll get the recording in shortly thereafter so that you can access these recordings for reference too. But all of that information will be readily available, along with a lot of other asynchronous training materials on that EVV support page that we provided for you. A few dates, key dates going forward. Again, tomorrow is the official go live, December the 28th, 2023. And then shortly thereafter, given the time of year, we also have a couple of state closures coming up on both Friday the 29th as well as Monday, January the 1st. These are state holidays, so certainly hope you guys are able to enjoy the holidays. Those will be coming up, but we do want to remind everyone that the expectation is from the state that everyone will be collecting EVV data on January the 1st, again, whether that be through TheraP or through your third-party vendor. We are going to do another town hall next week, so it will be in this same time slot next Wednesday, January the 3rd at 1 Eastern. We're again going to do a town hall, which will, in many ways, it's going to be kind of a follow-up to the go live, kind of checking in on everyone. What are the questions folks have had? Have folks been running into particular issues or anything of that nature? That's our goal for our town hall next Wednesday. Beyond that, the state is also hosting a Go Live Touch Base with the network providers out there. As you can see, I have included the registration information for that for Zoom right here on the slide that you'll have available to you, but that's going to be on January the 8th, which is the following Monday. That is going to be at 10 a.m. Eastern Time or 9 a.m. Central Time. So this will be a great forum for you guys to spend some time with the state to provide your feedback on how things have gone so far, and certainly to ask questions and raise any issues that you may be running into. So we certainly hope you guys will tune in for that. And again, throughout this entire go live period and the holidays and everything else, we certainly want to be there for you to support you in the use of our platform and our aggregator. And so please reach out to us again, as Stephanie said earlier, at the email alias on the screen, kysupport@therapservices.net. Also want to put a plug out there for those users. As part of your role, you're going in and looking to see that data flow across to the TheraP aggregator. As we've talked about in the past, for those of you that are doing that, that access is going to be monitored through the state Kentucky Online Gateway, effectively known as COG. And so if you have any questions around the utilization of COG, we've also included here a couple of resources, including the COG help desk at ky.gov, as well as a phone number and extension that you can access support with that application in the COG portal as well. So certainly feel free to reach out to those resources. And then again, as I said, the town hall next Wednesday is going to be a follow-up with general updates on how things are going through our go live, as well as any issues and questions that have popped up. So we hope you all will join us for that. So that brings us to the close of most of the content that we wanted to cover. I do want to give a minute for you guys to ask any additional questions that you may have through the Q&A. Again, we've been trying to address those that have come in, but you certainly have an opportunity here. If there are additional questions, I certainly encourage that you guys to enter those into the system. And while we're waiting, before we close out, I also would like to turn things over to Laura from the state with a final message that I think she would like to share as we approach Go Live tomorrow. Laura?
Thank you, Jason. And thank you all for being here today. We greatly appreciate it. We are really excited about the go live tomorrow. We wanted to let you know what the DMS expectations for EVV use are going forward. For January, providers must use EVV to capture data for 50% of visits. February, that will be increased to 75%. In March, we expect providers to use to capture data for 100% of the visits. DMS will be monitoring the implementation rates, and we will be providing technical assistance as needed. So again, thank you all for joining us today, and I'll hand it back to you, Jason.
All right. Thank you so much, Laura. And again, thank you to all of you guys. Thank you, Stephanie, for the time spent going through all of that. A lot of great information. Again, we will try to get these recordings and slides out to you guys as soon as we possibly can. So keep an eye on that Kentucky EVV support page. Taking a look right now at the Q&A. I'm not seeing anything else coming in right now, so I don't want to hold you guys captive. We will go ahead and close out today's call. Certainly, on behalf of the state and on behalf of Therap, we wish you guys a continued happy holidays and an exciting go live ahead. And please do not hesitate to reach out to us at the KY support at therapservices.net alias if there is anything that we can do to assist you all. And with that, we will close things out and talk to you guys again soon. Thanks, everyone.